News.
Now, families across South London whose children have been treated for cancer are being asked to take part in an NHS consultation to decide the future of children's hospital cancer care and where they'll be treated in the future. The shake-up of services follows an independent review which found patient safety of vulnerable children was compromised travelling between different hospitals. NHS England says it wants all future services from intensive care to radiotherapy based in one site. Aisha Baksh has the details.
He's a happy and lively 5-year-old, but for most of his young life, Jackson has been a cancer patient. Over 3 years ago, his parents were told he had a form of T-cell leukemia, and he's been in and out of hospital ever since.
He couldn't walk, so he had to learn to walk again. He used to crawl everywhere, he used to be in pain, he wouldn't talk. So yeah, to see it all now is, it's really, really good, yeah.
Jackson was treated at the Royal Marsden Hospital in Sutton and here at St George's in Tooting.
That's a good thing about this hospital. If we ring up and he gets temperature, we get a bed straight away. So that we don't have to go through A&E like some hospitals. It's just literally in a room, isolation room, and then we're there.
For many years now, there's been a partnership between the two hospitals. Back in 2011, members of the royal family opened a new children's centre at the Royal Marsden. But following a review, the world-leading hospital was told it can no longer treat children as it lacks its own paediatric intensive care unit. NHS England say all children's cancer services must now be located on one site. At the moment, some young patients have to transfer from the Royal Marsden Hospital in Sutton and Chelsea to here at St George's in Tooting. The counter-proposal is from the Evelina Children's Hospital in Westminster, and NHS England say that both proposals have scored highly and will be taken forward for consultation. The Evelina Children's Hospital is part of Guy's and St Thomas's Trust. In a statement, a spokesperson told BBC London they would provide outstanding specialist paediatric services and world-leading clinical research infrastructure. Meanwhile, at St George's, they say they have already 25 years of experience of delivering specialist cancer care and will be updating the current site in South London. Emma, how would that work in practice?
So essentially the George's would be having some new facilities, some new wards, and we would bring all of children's oncology care in South London, primary treatment, which is the main treatment centre, onto one site at St George's Hospital, which would include our paediatric intensive care unit and all our wards, our surgical, our brain surgeons, our general surgeons would all be on one site. It's a patient safety decision and I think it fits with the rest of the UK's cancer care, which is all on one site.
NHS England say services are not expected to move any time before 2026, but one cancer patient group fears any move may create extra anxiety for families.
Anything that would bring further concern or stress or worry would be something that needs to be addressed. I think if there's any change with a medical team or a hospital, I think emotional support as well as practical support really needs to be key for any families facing this.
Jackson has now finished his treatment at St George's, although he'll still get support and checkups when needed. His parents and others will be asked for their views on where children's cancer services should be located in London through an NHS consultation starting this summer. Aisha Baksh, BBC London.
Now let's take a quick look at some of the day's other news. More than 1